Hello, everyone, and welcome to C International Tutors. We are committed to bringing knowledge and skills to your doorsteps. This video is on the topic, Exploring the Misconceptions in Research Methodology. After watching this video, you will know the definition of research methodology, and misconceptions. You will also learn the common misconceptions in research methodology and the best practices for addressing them. Let's get started by defining the key terms. The key terms to be defined include research methodology, and misconceptions. What is research? Research is a systematic inquiry into a specific topic or question to obtain new knowledge, expand existing knowledge, or confirm and refine previous findings. Research is a rigorous and disciplined process involving collecting, analyzing, and interpreting data to answer specific questions or solve particular problems. What is research methodology? Methodology refers to the systematic, theoretical analysis of the methods applied to a field of study. Research methodology, therefore, basically refers to the study of research methods. Research methodology is a systematic and strategic framework that guides the entire research process. It encompasses the philosophical approach, methods, and techniques employed to collect and analyze data, leading to the generation of new knowledge or the enhancement of existing knowledge. What is a misconception? A misconception is a belief, idea, or understanding that is incorrect or inaccurate. It is a misconception if it does not align with the facts, evidence, or reality. Misconceptions can arise from various sources, including lack of information or education, misinformation or disinformation, cognitive biases or assumptions, cultural or social influences, and personal experiences or anecdotes. It is important to address and correct misconceptions to ensure a clear understanding of the world around us. Let's examine the common misconceptions in research methodology one by one. The first misconception we are going to examine is the misconception that research methodology and research design are the same. To understand the discussion here, let's examine the components of research methodology. Research methodology has several components. The key components, among others, include the philosophical underpinnings, research approach, research design, and the research process. Regarding philosophical underpinnings. Philosophical underpinnings refer to the foundational principles, beliefs, and assumptions that form the basis of a particular theory, approach, or system of thought. In the research context, philosophical underpinnings provide the fundamental framework that guides the researcher's perspective, shaping their views on the nature of reality, knowledge, and the research process. It is believed that ontological and epistemological perspectives determine the overall research philosophy and influence decisions regarding research design, methodology, and the interpretation of findings. Ontology refers to the nature of reality and the researcher's beliefs about the existence of the phenomenon under investigation. Researchers in the medical sciences mostly align with the ontological perspective. Epistemology deals with the nature and scope of knowledge. It explores how knowledge is obtained and the criteria for validating knowledge. Researchers in the social sciences mostly align with the epistemological perspective. Regarding research approach. A research approach refers to the overall strategy or plan that guides the researcher in designing and conducting a study. It involves the researcher's philosophical stance, the type of data collected, and the methods used to analyze the data. The three research approaches include quantitative, qualitative, and mixed methods. Methods refer to the specific techniques and procedures used to gather and analyze data. Quantitative method. This involves systematically collecting and analyzing numerical data to identify patterns, relationships, or cause and effect associations, for example, questionnaire survey. Qualitative method. This focuses on understanding the complexities of human behavior, beliefs, and experiences. It does not involve numerical data, for example, focus group discussion. Mixed methods. This is when both quantitative and qualitative data collection methods are employed in a study. Regarding research design. Research design is the overall plan or structure that guides the researcher in systematically collecting, analyzing, and interpreting data. The research design is documented as a research proposal. Drafting the research proposal is one of the steps in the research process. The research proposal contains the following sections. The preliminary section. This contains the title of the research, the name and address of the candidate, the college involved, etc., up to the abstract or summary. The body of the proposal. This contains Chapter 1, Introduction, Chapter 2, Literature Review, and Chapter 3, Materials and Methods. References and Appendices. Regarding the research process. The research process is a dynamic and systematic journey that transforms a curious inquiry into a structured and meaningful exploration. It is a carefully orchestrated sequence of steps designed to gather, analyze, and interpret data to generate new knowledge or address specific questions. Research involves a structured and systematic approach that typically follows 7 key steps. The first step in the research process is to define the research questions and draft a suitable title for the study. The next step is to conduct a thorough literature review to know what has already been done regarding the study to be conducted, how the studies were done, as a guide in conducting your study, and the gaps in the literature which your study aims to fill, thus contributing to knowledge. The next step is to design the study and document it as a research proposal, which will be submitted to an institutional ethical committee for approval to conduct the study. After ethical approval to conduct the study has been obtained, the next thing to do is to proceed to the field for data collection. After completing data collection, the next thing to do is data analysis, followed by interpreting the data and drawing conclusions from the information obtained. The last step in the research process is documenting the findings and communicating the research, as a project report, dissertation, or thesis, depending on the level of training and the guidelines of the institution concerned. Other methods of communicating the research include presentation at conferences and publication in scholarly journals. From the discussion so far, it is obvious that research design is just a component of research methodology. The second misconception we are going to examine is the misconception that research design and study design are the same. To understand the discussion here, let's have a brief introduction to research design again. Research design is the overall plan or structure that guides the researcher in systematically collecting, analyzing, and interpreting data. It is a blueprint or plan outlining how the research will be conducted, specifying the overall structure and organization of the study. It focuses on the overall research process and framework. Examples include experimental design, observational design, and mixed methods design. The research design is documented as a research proposal. Let's now examine the components of a research proposal. The research proposal contains the preliminary section, the body of the proposal, the references, and the appendices. The preliminary section contains the title of the research, the name and address of the candidate, the college involved, etc., up to the abstract or summary. The body of the proposal contains Chapter 1, Introduction, Chapter 2, Literature Review, and Chapter 3, Materials and Methods. Let's now examine the components of Chapter 3, Materials and Methods section of a proposal. The components of Chapter 3, Materials and Methods section of a proposal include background information on study area, study design, study population, including inclusion and exclusion criteria, sample size determination and sampling technique, method and instrument of data collection, personnel and pretesting, data collection, data analysis, including the statistical tests to be performed, quality assurance and validation, and ethical considerations. It can now be seen that study design is just one of the components of Chapter 3, Materials and Methods section of the documented research design, that is, the research proposal. The study design is, therefore, not the same as research design. Let's briefly introduce study design. Study design refers to the specific plan or blueprint for a particular research investigation within the broader research design. It is a focused set of decisions about how a specific study will be conducted. It pertains to a specific investigation within the broader research. It involves immediate planning for a particular research endeavor, specifying data collection methods and procedures. It focuses on the specific details and procedures of an individual study. Examples include cross-sectional study design, case control study design, and randomized controlled trial. To summarize, the discussions so far show that research methodology and research design are different, as are research design and study design. Further details are available in Tables 1.2 and 1.4 on pages 11 and 16 of the Book Essentials of Research Methodology for Students and Professionals, respectively. The third misconception we are going to examine is the misconception that research variables and statistical variables are the same. To start with, what are variables? In research and statistics, variables are any characteristic, number, or quantity that can vary or change over time, between individuals, or across different conditions and can be measured or quantified. In research, variables are classified by their role, while in statistics, variables are classified by the type of data they represent and the nature of their measurement. Let's briefly introduce research variables. Research variables are elements, traits, or conditions researchers manipulate, measure, or observe in a study. They are the core components of any research design and are essential for understanding and analyzing relationships, differences, and effects within a research framework. Variables can be anything that can vary or change during a study, such as characteristics of individuals, environmental conditions, or experimental treatments. Let's now examine how research variables are classified. Research variables are classified based on their role as follows: independent variables, dependent variables, moderating variables, mediating variables, or intervening variables, extraneous variables, confounding variables, control variables, predictor variables, outcome variables, or criterion variables, latent variables, manifest variables. Let's briefly introduce some of the types of research variables. Regarding independent variables. Independent variables are those that researchers manipulate or categorize to observe their effect on dependent variables. They are considered the cause in a cause and effect relationship. Example: in a study examining the effect of different teaching methods on student performance, the teaching methods, such as traditional, online, and hybrid, are the independent variables. Role: the researcher manipulates it to determine its effect on the dependent variable. It serves as the presumed cause in an experiment. Regarding dependent variables. Dependent variables are the outcomes or responses that are measured to see how they are affected by the independent variables. They are considered the effect in a cause and effect relationship. Example: student performance, measured by test scores, is the dependent variable in the same teaching method study. Role: it is measured to observe the effect of the independent variable. It serves as the presumed effect in an experiment. Regarding moderating variables. Moderating variables affect the strength or direction of the relationship between the independent and dependent variables. They explain under what conditions or for whom the relationship exists. Example: a moderating variable could be the student's prior knowledge of teaching methods and student performance in the study. The effectiveness of different teaching methods might vary based on the level of students' prior knowledge. Role: it influences the relationship between the independent and dependent variables. It helps to identify specific conditions or groups for which the relationship between the independent and dependent variables is stronger or weaker. Regarding mediating variables. Mediating variables explain the process or mechanism through which the independent variable affects the dependent variable. They serve as an intermediary link in the causal chain. Example: in a study examining the relationship between job training programs, that is, the independent variable, and employee performance, that is, the dependent variable, job satisfaction could be a mediating variable. The training programs might enhance job satisfaction, which in turn improves performance. Role: it serves as a mechanism or pathway through which the independent variable affects the dependent variable, and it provides insight into how or why a particular effect occurs. Regarding extraneous variables. Extraneous variables are those that are not of interest in the study but could influence the results. Researchers aim to control these variables to avoid confounding effects. Example: in a study examining the effect of a new drug on blood pressure, extraneous variables could include participants' diet, exercise habits, and stress levels. Role: it potentially influences the dependent variable but is not the main focus of the study. It needs to be controlled or accounted for to ensure valid results. Regarding confounding variables. Confounding variables are a specific type of extraneous variables related to both the independent and dependent variables, potentially distorting the true relationship between them. They can provide alternative explanations for observed effects. Example: in a study on the relationship between exercise, that is, the independent variable, and weight loss, that is, the dependent variable, diet could be a confounding variable. If participants who exercise also tend to eat healthier, the observed weight loss might be partly due to diet rather than exercise alone. Role: it can distort the perceived relationship between the independent and dependent variables. It needs to be controlled or adjusted to understand the relationship between the independent and dependent variables accurately. Let's briefly introduce statistical variables. Statistical variables are characteristics or properties of some events, objects, or persons that can take on different values or amounts and are used in statistical analysis. For example, age can be 25 years, 45 years, 70 years, etc. Height can be 1.5 meters, 1.65 meters, 1.7 meters, etc. Sex can be male or female, and marital status can be single, married, separated, divorced, or widowed. They represent the various attributes or quantities that researchers measure, manipulate, and analyze to understand data patterns, relationships, and trends. Statistical variables can be classified based on the nature of the data they represent and their measurement scales. Based on their nature, statistical variables are classified as qualitative or quantitative variables. Let's now examine how statistical variables are classified. Based on the nature of the data they represent, statistical variables are classified as qualitative variables and quantitative variables, which are also subclassified as discrete variables and continuous variables. Based on their measurement scale, statistical variables are classified as nominal variables, ordinal variables, interval variables, ratio variables. Let's briefly introduce some of the types of statistical variables. Regarding qualitative variables. Qualitative variables are variables that are classified by attributes or categories. They are also called categorical variables. Qualitative variables can be measured on nominal scale. In this case, the variables represent distinct categories or groups. They do not have a natural order or ranking, and only names are assigned. For example, sex can be male or female, and marital status can be single, married, separated, divorced, or widowed. Qualitative variables that are measured on the nominal scale are called categorical variables or nominal variables. Ordinal or ranking scale. In this case, the variables are listed in a specified order or rank. For example, the ranks of university lecturers can range from graduate assistant to assistant lecturer to lecturer 2 to lecturer 1 to senior lecturer to reader and finally to professor. Qualitative variables measured on the ordinal scale are called ordinal variables. Regarding quantitative variables. Quantitative variables are variables that result from counting or measurement. They can be discrete variables. These are quantitative variables that assume whole numbers only. For example, the number of students in a class can be 1, 2, 3, 4, etc., so it is not possible to have 3.5 students. Continuous variables. These are quantitative variables that can assume fractions. For example, the weights of the students in a class can be 45 kilograms, 50.5 kilograms, 64.7 kilograms, etc. Regarding their measurement scale, quantitative variables can be measured on interval scale. The starting point for this scale is arbitrary. It does not have a true 0 point, that is, 0 on this scale does not indicate an absence of the quantity measured. For example, a temperature of 0 degrees Celsius represents a temperature reading, as there can be temperatures below 0 degrees Celsius, such as -2 degrees Celsius, -10 degrees Celsius, -20 degrees Celsius, etc. Quantitative variables measured on the interval scale are called interval variables. Ratio scale. This scale has a true 0 point as its origin, and 0 means the absence of the quantity measured. For example, a weight of 0 kilogram means that there is no weight. Quantitative variables measured on the ratio scale are called ratio variables. The discussion so far shows that research variables and statistical variables are classified differently. The fourth misconception we are going to examine is the misconception that research methodology equals research methods. Equating research methodology with research methods is one of the most prevalent misconceptions. While related, these terms are not synonymous. Research methodology is the overarching strategy and rationale behind the choice of specific methods, including the theoretical framework, the design of the study, and the philosophical assumptions underpinning the research. Research methods refer to the specific techniques or procedures used to gather and analyze data. Research methods include qualitative methods, such as interviews, focus group discussions, etc., quantitative methods, such as surveys, experiments, etc., and mixed methods, which combines both. Understanding this distinction is crucial for developing a coherent and justifiable research design. The fifth misconception we are going to examine is the misconception that qualitative research is less rigorous than quantitative research. A common belief is that qualitative research lacks the rigor of quantitative research due to its subjective nature. This misconception stems from a misunderstanding of the purpose and nature of qualitative inquiry. Qualitative research aims to explore complex phenomena, providing rich, contextualized insights that numbers alone cannot capture. It employs systematic approaches to data collection and analysis, such as thematic analysis or grounded theory. Quantitative research focuses on quantifying variables and establishing patterns or relationships among them using statistical methods. Both qualitative and quantitative research can be rigorous if conducted properly, with appropriate attention to validity, reliability, and ethical considerations. The sixth misconception we are going to examine is the misconception that the more data, the better. Another common misconception is that having more data always leads to better research outcomes. While a larger sample size can enhance the generalizability of findings in quantitative research, it is not a guarantee of better quality. Relevance of data. The quality of data is more important than the quantity. Irrelevant or poorly collected data can lead to misleading conclusions. Contextual understanding. In qualitative research, a smaller, well-chosen sample that provides deep insights into a phenomenon can be more valuable than a large, superficial dataset. Researchers should, therefore, focus on collecting sufficient, relevant data that aligns with their research questions and objectives. The seventh misconception we are going to examine is the misconception that statistical significance equals practical significance. Many researchers equate statistical significance with practical or real-world importance, especially in a clinical setting, which can be misleading. Statistical significance indicates that the observed effect or relationship in the data is unlikely to be due to chance, based on a predefined threshold, for example, p less than 0.05. Practical significance concerns the real-world relevance or impact of the findings. A statistically significant result may have little practical importance if the effect size is small or if it does not translate into meaningful changes in practice or policy. Researchers should interpret statistical findings in the context of their practical implications and the broader field of study. The eighth misconception we are going to examine is the misconception that there is always one correct methodology for any research problem. There is a misconception that there is one correct methodology for any research problem. In reality, the choice of methodology depends on various factors, including the research question, objectives, context, and the nature of the phenomena being studied. Methodological pluralism emphasizes the use of multiple methodologies to address complex research questions from different angles, enhancing the robustness of the findings. Flexibility and adaptation. Researchers should be open to adapting their methodologies as the study progresses and as new insights emerge. Understanding that there is no one-size-fits-all approach in research methodology allows for more innovative and responsive research designs. The ninth misconception we are going to examine is the misconception that research must always be original. While originality is a valued aspect of research, there is a misconception that all research must be entirely novel. This can discourage replication studies or research that builds upon existing work. Replication studies play a crucial role in verifying and validating previous findings, contributing to the robustness and reliability of scientific knowledge. Incremental advances. Research that extends or refines existing theories and findings is equally valuable, providing deeper insights and filling gaps in the literature. Encouraging a balance between original and replication research is essential for the advancement of knowledge. The 10th misconception we are going to examine is the misconception that empirical research is more rigorous and more valid than non-empirical research. There is a common belief that empirical research, which involves direct or indirect observation or experience, is inherently more rigorous and valid than non-empirical research, which is based on theory, logic, or review of existing literature. Empirical research. This involves collecting data through direct or indirect observation or experimentation. It is valued for its ability to provide concrete, measurable evidence. Non-empirical research. This includes theoretical research and literature reviews. It plays a crucial role in developing new theories, synthesizing existing knowledge, and providing context for empirical findings. Both empirical and non-empirical research are essential for a comprehensive understanding of any field. Non-empirical research can guide empirical investigations and help interpret empirical results within a broader theoretical framework. The question now is, how do we address the misconceptions in research methodology? The best practices for addressing the misconceptions in research methodology include comprehensive literature review, clear research questions and objectives, methodological transparency, training and education, and peer review and collaboration. Let's briefly explain the best practices for addressing misconceptions in research methodology. Regarding comprehensive literature review. Conducting a thorough literature review helps to understand the existing body of knowledge, identify gaps, and clarify common misconceptions. It provides a foundation for developing a sound research design and justifying methodological choices. Regarding clear research questions and objectives. Formulating clear and focused research questions and objectives guides the selection of appropriate methodologies. It ensures that the research design is aligned with the goals of the study and addresses the key aspects of the phenomena under investigation. Regarding methodological transparency. Researchers should be transparent about their methodological choices, including the rationale behind selecting specific methods, the theoretical framework, and any limitations. This transparency enhances the credibility and replicability of the research. Regarding training and education. Ongoing training and education in research methodology are crucial for researchers at all levels. Understanding the principles and practices of different methodologies reduces the likelihood of misconceptions and promotes rigorous research practices. Regarding peer review and collaboration. Engaging in peer review and collaboration with other researchers provides opportunities for feedback and critical evaluation. It helps to identify and address any misconceptions or biases in the research design and interpretation of findings. In conclusion, misconceptions in research methodology can undermine the quality and credibility of academic research. By recognizing and addressing these misconceptions, researchers can develop more robust and reliable studies, contributing to the advancement of knowledge in their respective fields. If you want to have the full details of the topic covered in this video, please endeavor to have a copy of Volume 1 of the Book Essentials of Research Methodology for Students and Professionals. To buy the book online, please access the order form at the address shown. Thank you for watching this video. If you found it enlightening, please give it a thumbs up and share it with your colleagues. For more educative content, please subscribe to our channel and hit the notification bell.